Welcome to our YouTube video exploring the effects of consuming fentanyl. In this video, we'll delve into the physiological and psychological impact of this potent opioid on the human body and mind. From its initial administration to its pervasive effects, we'll uncover the intricate mechanisms behind fentanyl's influence and shed light on the risks associated with its consumption. 1. Introduction to fentanyl. Fentanyl is an extremely potent synthetic opioid used primarily for managing severe pain. Fentanyl, an extraordinary synthetic opioid celebrated for its unparalleled potency, represents a paradigm shift in the landscape of pain management. Originating as a solution to the exigencies of surgical anesthesia, this pharmacological wonder has transcended its initial purpose to become a cornerstone in the treatment of a spectrum of debilitating pain conditions. With a potency eclipsing that of morphine by an astonishing 50 to 100-fold, fentanyl emerges as a formidable bulwark against even the most obstinate manifestations of suffering. Its efficacy, rooted in its ability to swiftly and decisively intercept pain signals, offers a lifeline to patients ensnared in the relentless grip of severe and chronic pain. Yet, beneath its veneer of therapeutic promise lies a perilous duality, a seductive allure that renders it susceptible to the siren call of misuse and abuse. The very attribute that distinguishes fentanyl as an indispensable analgesic also imbues it with a potent magnetism, attracting those seeking refuge in its transient euphoria. Consequently, while its advent heralds a watershed moment in the annals of pain relief, it also underscores an imperative mandate for meticulous oversight, comprehensive education, and judicious administration by vigilant healthcare stewards. Only through a multifaceted approach encompassing rigorous monitoring, patient education, and responsible prescribing practices can we harness the transformative potential of fentanyl while mitigating the perils inherent in its unparalleled potency. 2. Mechanism of action. Fentanyl binds to opioid receptors in the brain, blocking pain signals and inducing feelings of euphoria. Fentanyl's mechanism of action unfolds as a complex interplay of molecular interactions within the intricate framework of the body's neurophysiology. From the moment of administration, this potent synthetic opioid embarks on a multifaceted journey through the bloodstream, traversing the vast expanse of the body's vascular highways to reach its ultimate destination, the central nervous system. Here, within the cerebral confines of the brain, fentanyl meticulously navigates its way to specific neural enclaves adorned with an array of opioid receptors. With remarkable affinity, it engages in a sophisticated molecular dialogue with these receptors, initiating a cascade of intracellular events that culminate in the modulation of neuronal activity. By binding to mu-opioid receptors, predominantly situated in regions responsible for pain perception and emotional regulation, fentanyl effectively dampens the transmission of nociceptive signals while concurrently altering the release of neurotransmitters involved in mood modulation. This intricate dance of receptor binding and neurotransmitter modulation orchestrates a symphony of analgesic efficacy, offering respite from the relentless onslaught of pain. However, amidst the orchestral grandeur of pain relief lurks the specter of adverse effects and potential harm. The delicate balance between therapeutic benefit and untoward consequences underscores the need for meticulous dosing, vigilant monitoring, and comprehensive patient education to mitigate the risks associated with fentanyl use. Thus, while fentanyl's mechanistic prowess affords a beacon of hope for those grappling with debilitating pain, its comprehensive understanding and judicious application are imperative to navigate the complexities of its pharmacological intricacies. 3. Physiological effects. Fentanyl can cause respiratory depression, leading to hypoxia and potentially coma or death. Fentanyl's physiological effects unfurl as a nuanced tapestry of responses across the intricate canvas of human physiology, reflecting its profound influence on essential bodily functions. As a potent opioid agonist, fentanyl's primary action commences within the inner sanctum of the central nervous system, where it orchestrates a symphony of molecular interactions with remarkable precision, binding with exquisite specificity to mu-opioid receptors. This molecular liaison triggers a cascade of events, orchestrating a profound modulation of respiratory function, a phenomenon known as respiratory depression. Characterized by a slowing of both the rate and depth of breathing, this respiratory compromise sets the stage for a cascade of physiological consequences, including the insidious specter of hypoxia, a critical condition marked by a perilous shortfall in tissue oxygenation. Moreover, fentanyl's influence extends its tendrils into the cardiovascular domain, where it conducts a delicate ballet, inducing fluctuations in blood pressure, heart rate, and cardiac output, further amplifying the complexity of its physiological impact. Furthermore, its potent analgesic properties elicit a spectrum of responses, ranging from the ethereal embrace of profound sedation to the unwelcome rigidity of constipation and the telltale narrowing of the pupils, a manifestation of its pharmacological footprint. Thus, while fentanyl emerges as a formidable sentinel in the battle against unyielding pain, its physiological effects underscore the imperative for a meticulous choreography of dosing, vigilant surveillance, and comprehensive patient education, navigating the labyrinthine terrain between therapeutic efficacy and the lurking shadows of potential harm. 4. Tolerance and dependence. Repeated use of fentanyl can result in tolerance, requiring higher doses to achieve the same effect, leading to dependence and addiction. Tolerance and dependence intricately weave themselves into the fabric of fentanyl's pharmacological narrative, revealing the dynamic interplay between its potent analgesic properties and the body's adaptive mechanisms. As fentanyl's tenure within the body extends, a subtle dance unfolds, a dance of accommodation and adjustment. The body, ever the vigilant sentinel, begins to acclimate to fentanyl's presence, necessitating ever-increasing doses to maintain the desired therapeutic effect, a phenomenon aptly termed tolerance. This escalating dose requirement not only amplifies the potential for adverse effects, but also heralds the emergence of a profound dependency, a symbiotic relationship wherein the body relies on fentanyl to sustain a delicate equilibrium. Dependence, thus, insinuates itself into the fabric of one's existence, manifesting as a symphony of physical and psychological manifestations upon attempts to curtail or discontinue fentanyl usage. These manifestations, ranging from the tumultuous throes of withdrawal to the relentless clamor of cravings and emotional tumult, underscore the potent hold that fentanyl can exert over mind and body alike. Hence, while fentanyl offers sanctuary from the relentless onslaught of pain, the specter of tolerance and dependence looms large, necessitating a judicious approach to prescribing, vigilant monitoring, and comprehensive strategies for addiction prevention and management. 5. Overdose risk. Misuse of fentanyl increases the risk of overdose, as individuals may inadvertently take too much in an attempt to overcome tolerance. The threat of overdose casts a wide and ominous shadow across the landscape of fentanyl's potent analgesic efficacy, highlighting the intricate web of risk factors and potential ramifications. At its core lies fentanyl's unparalleled potency, where even the slightest deviation from prescribed dosages can trigger a cascade of adverse events, plunging individuals into the perilous depths of overdose. Central to this risk is fentanyl's profound ability to depress respiratory function, hovering on the brink of respiratory failure, a precarious precipice with potentially fatal consequences. Moreover, the rapid onset and extended duration of fentanyl's action serve as insidious catalysts, enticing individuals to tread perilously close to the safety threshold in pursuit of intensified relief, unwittingly ensnared by the allure of fleeting respite. Complicating matters further are the myriad factors at play, including tolerance, polydrug use, and individual variations in pharmacokinetics, each layering upon the other to compound the likelihood of overdose. Thus, while fentanyl presents a potent weapon against relentless pain, Addressing the multifaceted risks of overdose demands a comprehensive strategy encompassing meticulous dosing, vigilant monitoring, and robust education to navigate the labyrinthine complexities inherent in its potent embrace. Thank you for joining us as we navigated the effects of consuming fentanyl. It's crucial to understand the profound impact this potent opioid can have on both our physiology and psychology. If you or someone you know is struggling with substance use, seek help and support from qualified professionals. Together, we can raise awareness, promote safety, and work towards preventing the devastating consequences of fentanyl consumption. Stay informed, stay safe, and remember, your health and well-being matter.